Hello, in this session, I'm going to show you how you perform general consultation in EHR. I'm already logged in, so I'm going to go straight to Workspace, go to the reception. In the previous sessions, we registered a client with the name Peter Ziva. So I'm going to search for that client. All right, you view, verify using the patient summary to make sure that you are viewing the correct client, and then open file and admit this client as an outpatient to the general queue. Right, then we're going to attend to patient. All right, so as you can see, we have a prompt here that's asking us to offer HIV and TB screening. I'm going to ignore this for now and go straight to consultation. So this is our consultation summary. The client doesn't have any other appointments. I'm going to go straight to vitals. Record the blood pressure. Record the temperature. Record the client's height. Client's weight. So this is basically how we record a client's vitals. You can proceed and record the pulse and the respiratory rate. All right, so after the vitals have been taken, then you can go to complaints. Record the complaint first. So suppose this client has got a headache. Then you select headache. Is it present now or not? And the duration. Then if there's anything else you want to add about this headache, then you can use this notes box. If not, then proceed and save. All right, because of this complaint, the system is already assuming that this could be a malaria suspect, and we're going to come back and go to that. I want to record another complaint. Maybe this client also has a fever. The fever is present, it's been there for 4 days, and then we save. All right, so we're going to go to this notification saying this could be a malaria suspect. If you click on it, it will give you further information that this one has malaria signs and symptoms detected, and the system wants to know if this is a suspected malaria case. I'm going to say yes. And because of that, you have to then do an investigation. Select category, which is lab. The sample we're going to use is blood, and we want to do malaria RDT. And then you save. Right. So there are two options that you can use to make this investigation. Either you can perform the test or you can send the test to the lab. I'm going to perform test because we now have rapid test kits. Add test. Test kit is RDT. Select the test kit batch and then add the result when it appears. So I'm going to go with positive, and then you save your result. After saving result, you update the final result as positive, and you save again. All right. So we've gone through complaints, and now we can do examinations. All right. Update examination. These are general examinations first. All right. If there's anything that you want to specify or add, then you can specify or add. So there are several examinations that you can also do. The central nervous system examinations, chest or respiratory examinations, cardiovascular, gastrointestinal, genitourinary system, musculoskeletal, as well as skin examinations. All right, so for now, I'm just going to go with the general examination, and then proceed and save. All right, so examinations have been successfully saved. We've gone to investigations and we've done the malaria test, which came out positive. Then we're going to go to diagnosis. So when you type in malaria, it will give you a number of types of malaria, and we're going to go with Plasmodium falciparum malaria. We can make this a final diagnosis, and then we save the diagnosis. Now we have to also add another diagnosis for the headache. Then save. All right. After adding diagnosis, then you can proceed and prescribe. So I'm going to record, and we're going to give this client paracetamol for their headache. They're going to take this orally 3 times daily for 5 days. If there's anything else to add, use this notes box. If this is going to be a repeat prescription, you also add how many counts they are, and then you proceed and save. Then we're also going to record another prescription for malaria. So I'm going to add Coartem. And then if there's anything else to add, and also if this is a repeat prescription, make sure you add the counts, and then you can proceed and save. All right, it's still saving. So after you've added the prescriptions, you can then dispense if you're able to dispense from that particular queue. If not, you can send this client to the next queue, which would be the pharmacy, so that they can get their drugs from there. You can also do your sundry dispense if you're able to dispense from that particular queue. And also there is a button for procedures, depending on the consultation that would have happened. If there's nothing else, then we can proceed and close and give this client an appointment. We want the client to come back after 5 days. Record an appointment. We want this client to come to the general queue. On the 15th for a review, sorry. And then you save the appointment. This also gives you an option to reschedule the appointment or even to add another appointment. So before you see the next patient, already the system is showing us this client has got 1 appointment. Then you'll be able to send this client to the next queue, which is the pharmacy, so that they'll be able to go and collect their drugs. All right, so this was general consultation.